Good afternoon, everyone. I'm so excited and glad to be here and to be the recipient of this year's McMichael Award. And thanks a lot for the panel for considering my research. My name is Milad Mohsenzadeh, and I'm from AU College of Systems and Society, School of Engineering, just across the university. So, and I'm so glad that the panel considered my research, which is a little bit of a different than the previous year's recipients' work, and I'm so excited to be able to use this award to further advance my research. A little bit of a background of my work. I have a PhD in energy from the University of Melbourne in 2022, and since then I've been joined with the different research groups and also working on my own research work in order to improve the efficiency and the energy and the effect of the climate change on the health and the environment. And I'm really glad to be joining this network that could able to help me to able to have a better engagement with the people who have been affected by the disaster and the climate changes around the world and in Australia, to be able to help them to provide them with a solution to improve their health and well-being. So if I talk about a bit of a problem and the background. So I'm focusing on the situation that we have been dealing with since the climate change kicked in and the crisis happening around the world, also in Australia more often, and that's about the water scarcity. That's something that's affecting people in the remote and the areas that the disaster affected. So, for example, in developed country like in Australia, at the moment we have over 700 regional and remote communities that they are 100% dependent on transporting drinking water from the major cities or the bottled water. This costs the government of Australia almost $13 million a year. And this is talking about around 40,000 also indigenous Australians. This is the situation for a developed country like Australia, but it is much more worse in developing countries and underdeveloped countries. And our colleagues from the previous years also touched on the water crisis on those regions, and also my home country, Iran. That this always was my concern, that maybe someday my research could have an impact for these regions to improve the health of the people. So the existing desalination technologies, they are energy intensive, costly, and not deployable after extreme and aftermath of flood in those regions, able to help people with their essential drinking needs. So we need a low-cost, off-grid, and a rapidly deployable water solution on those regions. And my research on floating solar desalination actually tries to offer a sustainable way to able to rapidly deploy this system in those regions and help people with their essential needs with drinking water until the system, the infrastructure could get back on and able to provide water to the people. And having McMichael Award helped me to work further on that technology, which I started from my PhD and continued after that. and it helps to improve the climate resilience of the people and also the community health. So just a little bit of a technology, very quickly, in general kind of words. So that system is going to be deployed on the surface of the water. Imagine the area has been flooded, and the water is everywhere, covered all the surface of those regions for days and if not for weeks. So that's somewhere that we couldn't deploy like a huge system to able to produce water for people, right? But this system could simply float on that water, and also some reservoirs that have been affected or they don't have a good quality for drinking, and basically could able to use the solar energy to take the water into the top, the flat top at the center of the system by a capillary effect, and heat it up to evaporate, to locally evaporate, and that I call it cluster evaporation, which requires much less energy. And by doing that, we have a vapor that lose all those salts, all those minerals, all those kind of diseases that can be in the water, and become vapor and go through the next part of the system that is a condenser that could able to condense that vapor into the water, and to be able to generate enough water, something around 4.5 liters of the water per day that could be able to supply drinking needs of a small family. So using the McMichael award and the funding would help me to more focus on the social part of this work. So far I've been more purely technical on developing the system. I'm also still going to use part of this fund to further characterize and further improve the component that is in charge of taking the water from the surface of the reservoirs, ponds, or the flooded area into the surface inside the system. And also the major part of the fund, I'm going to use it for the engagement, to able to get hands on the community, on these remote regions, to get more information and data about their actual needs and the situation of their lands and the quality of their water and the climate differences that they specifically have in these regions. This would help me to better design the system to be exactly to be used on those areas, and also get to able to demonstrate the system to the agencies and to the indigenous organizations, to able to get their support behind that, to able to move this system, this technology and the product for the next level, which is mass production of the system. So as an impact, scientific impact and the social impact that this award would have on the advancement of my research, would able to support reliable drinking water for remote and disaster-stricken areas, and reduce the transport costs and improve the health outcomes, and strengthen the climate resilience of the people in the remote areas around the country and indigenous communities. And as I mentioned, that the engagement strategy that I have under this award, under this fund, to further advance my work is more working with the community and getting their feedback and input to better improve the system. Hopefully someday it could be deployed and be used right after the disaster. Just remember an event that happened in Tonga Island a couple of years ago. That so the crisis and the tsunami came after, in that island, completely flooded the island and contaminated all those drinking water reservoirs. And what happened next? Even there was no way to transport water by the air to those areas, and we had to wait for 6 days until the first ships comes to those areas with the bottled water. So that's the 5-6 days that very key that the system could go and do its role until the main water supply arrives. And thanks so much for listening, and I'm great for this award this year.